Well, at this point, California has been able to maintain a proper system as far as hospitalizations. There's still room, but there's a lot of concern about keeping things in the right place. So when is too soon to open back up? Do we risk a second wave of infections if restrictions are lifted too early?
Chief Medical Officer with Dignity Health, Southern California, Dr. Nicholas Testa, is with us now to give us his perspective. Good morning, and thanks for joining us. When could we see the COVID-19? Good morning again. And when could we see that COVID-19 second wave we're hearing about? And how prepared are we?
So, there's two things that are going to influence the second wave. One is the relaxation of the social distancing measures we have in place. The second thing is going to be the seasonality, right? So we don't know about the seasonality. So that I kind of have to defer to, but the social distancing, we know there's going to be natural erosion of the social distancing. And then there's also going to be all of this conversation about social distancing measures being decreased. And as soon as that happens, we definitely will see a second wave. The question is, how significant is it going to be?
Well, and also, we're not even through with the first wave yet. We can't get too far ahead of ourselves. I would ask, too, Dr. Testa, about immunity. That's something we've heard Dr. Ferrer talk about a lot. We don't even know if you have immunity just because you had it the first time.
Correct. There's a lot of research happening right now because we're going to be doing the antibody testing. Antibodies tell you if you are immune or not, but we don't know what the immune profile looks like for a patient yet. So it's great that we're going to be doing this antibody testing. It's going to give us the first step for us understanding immunity, but we got a long ways to go to fully understand what an immune patient looks like.
Right. And let's get back to that question about preparing for opening up and loosening restrictions. How do we prepare?
Well, so the way we prepare is everything we've done for the last 6 weeks. So society has taken on this great burden of staying at home and, taking the economic hit. And it's allowed hospitals and healthcare systems to ramp up and prepare, because we know social distancing is going to stop, either because there's a government mandate or it's just going to erode. I mean, you go out and drive, you see that people are back on the streets. It's eroding naturally over time. So we've done a lot to get prepared and have a lot of the things in place so that if that second wave comes, we're going to be a lot more ready for it.
But do you find yourself up at night when you see Ventura County opening? I mean, that's just our next door neighbor. I mean, there's the possibility that everything that we've gone through might end up not being effective.
Well, I think what's most important is how we open, right? So this isn't an on-off switch, it's a dimmer.
Right.
So when we talk about opening up, we can't just turn everything back on. That's not going to be smart. What we're going to definitely see is a spike of patients then, right? Only about 5% of Los Angeles County has probably been exposed. So when we open up, it needs to be in a very logical, calculated way. So yes, we'll lift the stay-at-home orders, but we're probably not going to be going out to dinner, and we're probably not going to be going to concerts and sporting events. We're going to have to do this in a very calculated way. And I think it's important that we do that in that calculated way, because if we don't and we just tell everyone to stay at home indefinitely, we're going to see more of what we're already seeing, which is people are just going to take their lives back naturally.
Yeah, there's going to be some rebellion. We all need to be patient. Thank you so much, Dr. Nicholas Testa. Thanks for joining us today.
Thank you for having me.
Of course.